So this is part two, I guess video three of my series with Arya's surgery. I'm doing this the same day I did another one earlier, if you watched both. Um, to be honest, there's a lot of things that you have to change about your life when you have a dog that has a surgery like this. Um, and there's still a lot of unknowns that I don't know. But let's get into some things after surgery or picking up. The day I picked up Arya, I drop her off on a Thursday, early morning, and then she stays overnight, or has surgery that day, and then stays overnight, and I pick her up the next morning, which is a Friday. When I pick her up, she's shaved pretty much a third of her body, which is basically the leg that was operated on, her left rear leg, and it's for some people that can be very hard to see. You get debriefed by your doctor, and he tells you how the surgery went. I actually got a DVD of the after surgery X-ray, which shows the plate installed and the screws and all that. Unfortunately, I can't figure out how to open it up on my computer, but it comes with a disc, and I'm sure it's the program that they utilize. But there's got to be a way that I'd like to show you what the surgery looks like. Um, so really quick, let's get into a little show and tell here before I lose my light. Uh, I saw online many people, they have older dogs with the requiring surgery and things like that, or hip dysplasia, or that require TPLO surgery like Arya did, and people got these hip harnesses. Now, this is the one I purchased for Arya, and it's probably, I forget it even. It doesn't matter. I mean, it comes right down to it. You want your dog to be healthy. You want your dog to be comfortable. You want your dog just like you would for a kid, maybe. So you purchase things and you go for it. So this is it's nylon. It's padded. It's got a breathable mesh on the inside. It's black. Um, let me get one more thing. I'll show you. Sorry for the walking away from the camera. So I got the reason why I went and got this is because this is black. So this is black, and this is a comfort cone. Um, it's Velcro. There is a method you can use to attach. Maybe this is elastic. Maybe that you can attach the collar, the dog's collar, to this. Um, but it's got Velcro so that you can just pretty much put it around the dog's head like that, and it stays. Um, and depending on your dog, and the deal is you can't leave your dog while they have this recovery stage going on. Now I found that Arya, she's pretty good about the licking part. She doesn't lick the wound. She does always been a lick of her feet type of dog, so I've always been aware of that, and I stay on top of her, and if she has an issue, she gets the cone. Um, but I haven't found I've needed to leave her in the cone the whole time. Your doctor will tell you first 6 weeks at least you got to have the cone on 24/7. Now you have to make the determination yourself. The worst thing that can happen is if your dog will have an irritant with the wound and go at the wound. In other words, open the stitches, open up the wound. I imagine if the dog causes bleeding, it will intensify irritant of the wound. Your dog may sit all night licking the blood out of the wound that's going to continue to bleed. Not to get too gruesome, but that's one of the things. You don't want your dog to go after the area. So the cone is necessary. Now they charge you for those cones at the thing, and I have one here, and I get one. I'm never going to have to buy another one if the surgery is required, or injuries, or whatever. And with the vet bills the way they are, you want to minimize as much as you can. With that minimization, you go out and purchase stuff that you maybe not need. This is being one of them. Now, for some people, this might be a good thing to have. For my dog, it completely immobilized the front feet. Now, how does this work? Should be attached, don't you think? So this is you go underneath the waist in front of the back legs, and then you cover it, and then you Velcro it, if you will, like so. And then this, once it's on, this is how you keep both the, see, it would be better if this was attached to something, because, for example, you're not walking your dog miles, you're taking your dog out to go to the bathroom. Now you're going to have a leash on as well, and then you have this. But you wind up, I found it didn't work for my dog, because my dog won't move with this on. And then to go to the bathroom, the dog won't squat with this. She'll stand and not do anything. And you'll just be standing there wondering what the heck you're going to do. Your dog has to go to the bathroom, so what do you do about it? So what I did is I've just not been using this. The dog, she does her three-foot tripod hop, and I told you about the pad being ripped. So you really have to be careful. You cannot walk your dog a lot. It's not, let's go get some exercise, puppy. It's go out for pee and poo, and then you got to bring your dog back inside and put her back in her pen. Whatever comfort area you put your dog in. And then medication. Medication was the other thing. My dog doesn't like to take pills. And I've used different methods. I've used pill pockets. Okay, I'm not going to show the brand, but you get the idea. It's a treat, but the dog knows it's in there. And now she won't even eat the treats. Like if I put one of those, pulled one out with nothing in it and threw it at her, she'd look at me like, hell no, I'm not touching that. So the dogs are smarter. You have to be smarter as well. But there's only so many things you can utilize. What I found works best for me is cheese. I call it puppy cheese. And you get the plastic wrapped individual American cheese pieces. Are you watching me make a video, Papa? Look at this girl. Yeah, right? You want to be on TV too? Okay. You happy, puppy dog? Now lay down and go to sleep. So, sorry. Just trying to include the puppy as much as I can. I forgot where I was at, but the puppy method is basically, puppy cheese method is those individual slices you buy that are wrapped in plastic. Get one of those. You fold a third over. Like say you got to take 2 pills. Fold 1/3 over. Take the pill. Put it on the cheese. Make sure, I was suggested to make sure that if you're holding the food, you hold the food with the hand that didn't touch the pill. That will help as well, because the dog's sense of smell will pick up on that medication. You fold the piece of cheese over the third that you broke off, and then you have like a flat pancake, if you will, of cheese. You press the sides down gently, and then you have like your own little pocket of cheese pill with a pill inside. And then you take another third, you do the same thing with the second pill, and then you fold that in half just like you did the first, making a little sandwich of cheese, if you will. You can do this whatever size you want, but I figured 2 pills, 1 slice of cheese, and then you have 1 strip left. Okay, that's the teaser. So if the first pill is an issue. You give them the long slice that has nothing in it. So you give that first, and then afterwards, very quickly, you give back the other two pieces that are the pancake filled pieces of cheese, and that will work for the dog. Now, what do you do about a pill that's bigger? Now, there are these pills I have that are antibiotics, and they're a capsule. It's a little bit bigger. Let's say it's this big. It uses this. And this is what I bought. You basically, you have, this is how this thing works. Some people, you say two-finger method with a pill, which is where you force the dog's mouth open by doing this. And then you take the two fingers and you push it back as far as you can, and then you force it down the throat and then close the mouth of the dog. Most dogs don't like that. My dog won't allow me to open up her mouth that way. In fact, well, let's move on to this thing. Okay, you can buy these at any pet store, I think. I got this at the pet, that one. So just think with your brain and you know which one I'm talking about. This pretty delicate little thing here, it's not meant to last forever. It's only meant to last for a short period of time. You put the pill in this end. These two pieces don't detach. What this is this is how you determine how far in the mouth of the dog. Like, I'll show you. So basically, let's say the dog's throat is that big. You're going to push this thing to a certain distance so that I don't know if I can do this on camera. So like if it goes in the mouth, you want to not go too far back in the throat. So this is like a stopper. So you got to determine how deep your dog's throat is. You could just guesstimate it. So that way you can push it to the front of the teeth. And then when you have to depress the plunger to put the pill in, all you have to do is that. So like say the pill is in there now. You see, this comes with a little piece of paper wrapped around here you have to take off. I thought it was first a seal. So you take that piece off, and then it allows you to make the press. And then the pill comes out the front end, drops down the throat. Close the mouth, pull this out, close the mouth, maybe rub the throat a little bit, and then down the pill goes. So the important thing and why I'm talking about this is that you got to make sure your dog has their medicine. You don't want infection. You don't want them to feel pain constantly. If your dog feels pain, your dog's going to be awake throughout the night, and then you're going to be awake throughout the night because you can't allow your dog to nit and pick or have an issue with the pain or whatever. You don't want complications with the surgery, which is why you have to be 24/7 on your animal, your dog, like I am. So those are my suggestions. I hope this is going to help maybe some people out there. I'm sorry for my randomness of video and everything, but I'm just throwing it out there as a regular guy. I'm not professional, of course, just a guy that cares about his dog. So if you want to see more or you have any questions, please feel free to leave a comment. Thanks.